people that are addicted to methamphetamine and opiates and alcohol. And that seems to be the largest population, the majority of the people that I see.
Okay.
And also, these are people that have had diagnoses of bipolar,
Okay.
depression, anxiety,
Mm-hmm.
and it seems to be a very difficult combination to get over.
What seems to be the biggest obstacle for dual diagnosis patients in obtaining long-term or permanent sobriety?
Well, once they get off the drugs and alcohol, which seems to be helping them to some extent, many, of course, overdo it, but when they're helped by that and they get off it, they still don't feel good, and a lot of times the psychiatric medications are causing as much of a problem because they don't feel good with it,
Okay.
and they're still going to look to feel better.
You mentioned medication. What's the most common treatment for these types of patients, and how effective is it at providing long-term recovery?
Not very effective at all. Mostly, most of the prescription items that are written are for antidepressants, for the anti-bipolar medications, which are really anti-seizure medications that they use now for bipolar. It's supposed to even you out. It's supposed to calm you down, even you out. Doesn't seem to, and sometimes it makes them feel too calm and just almost, just deadened.
Do you believe that there's a more effective treatment available for dual diagnosis patients? And if so, can you tell me what it is and how you discovered it?
Well, by looking at everything, basically it would be a field called psychoneuroendocrinology. And it's primarily what I do. I'm a psychiatrist, and I'm board certified by the Board of Psychiatry and Neurology. And I've looked into endocrinology, and this is what I've seen. I've seen that a lot of the things that are described as psychiatric disorders are actually a disorder or an imbalance of hormones, and primarily the stress hormones, and in particular, oddly, cortisol.
So psychoneuroendocrinology, just for me, since I'm not an MD, is the study of hormones and how they affect the mental health of someone?
Exactly.
Okay.
They affect, and how hormones affect the mind and behavior. It affects your mood, and then your mood affects how you behave, and your concepts, your emotions affect how you behave.
And that seems to be a more effective avenue or treatment for dual diagnosis patients?
It seems to be. Of the patients that I've seen, and I've seen quite a number of them, it does seem to give them a better chance at recovery.
You mentioned cortisol deficiency. Is there a test or something that someone can take to determine whether they have that problem, rather than just talking to someone over a desk saying, I have these symptoms, or is there actual lab work that can be ran?
Well, it's two things. And when you make a diagnosis in medicine, and I'm primarily a medical doctor, what you do is you do a history and physical, and you find out all the things about the person, all their problems, all their issues. You do a physical exam, and then you do laboratory work. And laboratory work is it's to corroborate, or to actually prove that, or show that maybe it's something else, but it's to take a look and see, and you can look for cortisol. There are certain tests that you can do that give you a better understanding of what a person's cortisol balance is.
Okay. So cortisol is produced by the body naturally, and it's essential for mental health and well-being, along with other stuff, I'm sure. But you believe that it's linked closely to a lot of dual diagnosis patients?
Absolutely. It's been called the stress hormone, and it's somewhat a misnomer, because it's, people think, oh, it's bad for you because it's a stress hormone. It's causing stress. It's really not causing it. It should have been probably called the anti-stress hormone, because it helps you with stress. It's the thing that calms things down, and one of its main jobs is to bring fuel into the brain cells, into the power plant of the brain cells.
This hormone, cortisol, is not producing enough fuel for the brain. There's really no way for the person to function or act or behave or have any kind of regular mood pattern.
Well, the picture that comes to mind is a dog being wagged by its tail. It doesn't have a clue. It's you being pushed around by the feelings that you're getting from being imbalanced, or having an imbalance of these hormones. And I say these hormones, it's not just cortisol, it's also adrenaline. And adrenaline is the hormone that makes people feel uncomfortable. But adrenaline's like the strike breakers. You do need fuel to go into your brain cells, because without that, your brain does not think. If that feels like to a person, it feels like depression, it feels like boredom, and a lack of interest, lack of motivation.
Maybe anxiety?
Anxiety. No, that's not the anxiety. The lack of the cortisol, the lack of the fuel feels like boredom.
Okay.
And it's not, oh, I'm bored. It's something I've coined. I call it a screaming boredom. It's like, I have to do something right now.
Okay.
It's a terrible feeling. And that could be considered anxiety, of course.
Sure.
But adrenaline is like the strike breakers, and it's sort of like the emergency broadcast system. It sends out, your brain sends out a signal, we're not getting any fuel here, we're dying, and it goes to the adrenal glands, and in the middle of the adrenal glands, which sit on top of the kidneys, it sends out adrenaline.
Okay.
Now, adrenaline is kind of a save-you hormone. It comes in, it's like the strike breakers, it's too much, too little, and never quite right, and it makes you feel uncomfortable. It's the fight-or-flight hormone.
Okay.
I don't know if everyone's heard that, but the fight-or-flight hormone. And you have that, you want to either hit someone or you want to run away.
If someone's suffering from a dual diagnosis and that they may have that kind of problem, and they receive this treatment, how quickly do they respond to it? And what are some of the most noticeable improvements that a patient would experience by getting this type of treatment?
You know, to me, it's actually shocking to me to see how well people do respond. For the most part, I would say within a couple of weeks, you're going to see a marked improvement, like a big improvement.
Wow. So they respond relatively quickly,
yes,
and the improvement mainly that they feel is some sort of relief?
Totally, yes.
Some sort of relief from the withdrawal of the drugs, or the aftermath of their what landed them in treatment in the first place. They feel some relief from that.
You know, they're self-medicating for an underlying problem, and you take that away, and you're not giving them anything that really supports them, because what they've done unknowingly is they've slowed down their adrenaline. It makes them feel better, and they've increased the cortisol going to their brain and to the rest of their body, and they feel better when they're using their drug or alcohol. And the people that, whatever drug people like, for them, genetically, they're predisposed to having their cortisol go up.
When they take it.
When
Okay.
they take it. So some people it's alcohol, some people it's opiates, some people it's something else. So everyone, or a stimulant like methamphetamine, and actually that seems to increase cortisol for the people that like it.
Well, that sure would make sense why people go back repeatedly to use a drug and alcohol that they know is going to end them up in trouble, because it actually does give them relief. It corrects, if I understand correctly, it corrects the deficiency that they have biologically through the substance or whatever it is that they like.
That's very well known, actually, and that's very well studied, and there's a lot of studies to kind of show that that's what people are doing.
Right.
And with people that are alcoholics, it increases their cortisol. Actually, cigarettes will also increase cortisol.
How many doctors or treatment centers provide this type of treatment that you've just described, and how would someone get in touch with them?
Unfortunately, there's not a lot of people that do this, and that surprises me too, because this is something that most people learn in medical school. It's not anything that's odd, it's not strange. Cortisol's been around for a long time and has been discovered, if you will. The natural stuff is actually better for us. Our bodies really know more what to do with that. But very few centers, even though there were many studies, there were actually a number of studies done at Yale some years ago, talking about how opiates increase cortisol. If someone has low cortisol, why not just replace that? Why not just treat it? And
right.
It seems to be a logical thing to do with low doses.
Thank you for your interview today, Doctor, and
My pleasure.
we look forward to speaking with you more.
My pleasure.